Hello, in this video, I'm going to talk about functional anatomy of gastrocnemius and soleus. So quickly, some basic anatomy. Collectively, these two muscles together are sometimes referred to as triceps surae. Triceps meaning three heads, so two heads of gastrocnemius, one head of soleus, and then surae meaning the sural region, which is the calf. So the three heads of the calf is essentially what that means. So gastrocnemius is the larger, stronger muscle between the two. Gastroc includes two heads, as I mentioned, a medial and a lateral head. And gastrocnemius crosses both the knee and the ankle. So it's biarticular, which means that we need to consider passive and active insufficiency. Soleus is uniarticular, meaning that it only crosses the ankle, it only crosses one joint. So together, both plantar flex the ankle. But gastroc also has the additional movement of flexing the knee because it crosses both joints. So, with all biarticular muscles, we must consider passive and active insufficiency and think about when the muscle is at an advantage because it is biarticular. I linked in the description a video where I discuss what passive and active insufficiency are. So passive insufficiency, when it comes to gastrocnemius, that is where we have a limit in our range of motion at either of the joints that it crosses because the muscle cannot extend to a great enough length to allow for full range of motion at both joints at the same time. So that occurs for gastroc when we have simultaneous knee extension and ankle dorsiflexion. So how much dorsiflexion we can achieve with the knee extended is going to depend on the length of gastrocnemius. The opposite problem is active insufficiency, when a muscle can't shorten to a great enough extent to contribute force at both joints at the same time. So in the case of gastrocnemius, it means when the knee is flexed and the ankle is plantar flexed at the same time. So when the knee is flexed, it takes the tension off of gastrocnemius. And in that position, when the knee is flexed, gastroc is not able to shorten to a great enough extent to be able to contribute tension and force at the ankle joint in plantar flexion. So what that means is when we plantar flex with the knees also flexed, gastrocnemius is not engaged. The knees need to be extended or in the process of extending to be able to engage gastrocnemius. And so that is the biarticular advantage of gastroc, is that if we are going through simultaneous knee extension while the ankles are plantar flexing, then that allows the muscle to maintain a similar length. So it's getting longer at one end of the muscle and shorter at the other end of the muscle. And so maintaining that consistent length is going to optimize the muscle's ability to produce force. So simultaneous knee extension and ankle plantar flexion, like we see in a jump, like in the picture here. Okay, so the person goes down in the counter movement, and then when they push up to leave the floor, then their knee is extending and their ankle is plantar flexing simultaneously, which is when gastrocnemius would be at its greatest advantage. Now, gastrocnemius also has a greater proportion of type 2 muscle fibers compared to soleus, which means that gastroc fatigues more quickly, but it's also capable of more explosive power. So this is really the muscle we would use for jumping and running and those momentary, more explosive movements. Compared to soleus, which has a greater proportion of type 1 fibers. So soleus is a postural muscle. It's important when we're just standing and walking. It helps keep us upright. It maintains the position of the ankle. So it's great. It's important for endurance and maintenance of posture, but also less capable of the explosive power that we get from gastrocnemius. So when the knees are flexed, soleus is the prime mover in ankle plantar flexion because gastrocnemius in that situation is experiencing active insufficiency. So soleus is important anytime the knees are flexed or in cases of endurance or movements where there isn't a big requirement for large force production or power. Now, in these pictures, this is downward facing dog. It's a yoga pose. In the bottom picture, the knees are extended and we've got the feet planted on the floor. So in this case, this is a stretch of gastrocnemius because the knees are extended. Now, in that same posture, if you bend the knees, now there's slack in gastrocnemius. So now gastroc is not being stretched in this posture. But assuming that we're driving the heels towards the floor with the knees bent, now we're stretching soleus in that posture. Okay, so quickly want to go through the difference between a standing and a seated calf raise when it comes to gastroc and soleus. So in a standing calf raise, that's where we have the knees extended. Gastrocnemius is at an advantage and it's highly engaged. So in a standing calf raise, we are targeting primarily gastrocnemius. Soleus is also going to be involved. It's going to contribute, but it's not as big or strong as gastroc, and since it's uniarticular, it has less of an advantage as gastroc in that position. Now, in that standing calf raise, let's say we want to target the medial head of gastrocnemius. We would do that with the toes angled in, like we see in this bottom picture. So we have the toes close to each other and the heels separated, and then we go up in plantarflexion. That's going to target the medial head of gastrocnemius. And then the opposite would be if we angle the toes out with the heels close to each other and then go up in plantar flexion, that is going to target the lateral head of gastrocnemius. If we just are in neutral and the toes are facing forward, then we're equally distributing the weight of the movement on both heads of the muscle. Now, compared to a seated calf raise, so that's where the knees are flexed, you're sitting in a seated position. In that case, gastrocnemius is disengaged because of active insufficiency. It's not able to contract and shorten to a great enough extent to produce force at the ankle. So in that case, we're targeting soleus and some of the other smaller plantar flexors. So like tibialis posterior, for example. So the other plantar flexors, in addition to soleus, would be engaged there. But soleus in that situation would be the prime mover. All right, thank you so much for watching, and I will see you in the next video.